get started, guys. We're getting close to the end of the day. As you guys can see, I guess we're in the fourth quarter, the very start of it. And we are going to get into what can you do to help the CDCN in this fight. And I think to boil this down, it's how can you help us help you? I think that's the way you can think about our research. Like giving samples, joining the registry, you're helping us so we can help you. So what can we do? So the first question is, on our website we have a place that's opportunities to help patients to fight back. Again, help us help you. And so the first thing on that would be to visit an expert to understand your disease. We talked about this a bunch of times today. We have a really incredible list of doctors all over the world that have experience treating Castleman disease, lots of expertise. Some people have more expertise than others. So we're going to give you we have a large list, probably over 30 doctors across the U.S. Even within those 30 doctors, there's a handful that have the most experience. So if you find someone in your neighborhood or in your town, it might make sense to go see that person. But if you're going to be traveling, you can always ask us, and we can tell you who are like the 2 or 3 people that are closest to you that maybe would be worth traveling to. We can definitely help you with that. You can see over 30 on the referral list. The next thing is tracking your abnormal lab tests. I know that feels like, wait a minute, isn't my doctor supposed to be tracking my abnormal lab tests? Like, do I really have to do that? And the reality is that your doctor should be tracking your abnormal lab tests, but they also have hundreds of other patients, and Castleman is complicated. And it's different than a lot of other diseases. So if your doctor treats a lot of cancer, it's pretty clear when cancer comes back. It's either there or it's not there. Castleman disease is much more complicated. It being there is actually your immune system being activated, it's blood tests changing. Seeing Castleman's isn't as black and white as cancer or lymphoma, where it's there or it's not there. This is really a complicated disease where your blood tests actually tell you the status of your disease, and your doctor may not be following your blood test as closely as maybe you need to be. And so I hate to tell you to take on another role, but when you go home, you need to make sure that you're taking on that role of following your lab tests. Andrew's a great example. He's got his lab tests tracked out. He's got it trended out. You know, how things are changing. He's keeping track of how he feels while his lab tests are changing. And there's nothing better than to, some people might say, well, I don't want to just track lab tests, you know, if they're totally normal. There's nothing better than tracking normal lab tests. It's like putting the time in to track them, and oh my gosh, I wasted an hour of my time to track them being normal. That's great. Like, waste that hour, track them looking normal, but put the time in, because if they aren't normal and if there is something bad, you know, you want to be the first person to see it, and you need to be an advocate for yourself. These are some of the lab tests that can give an idea that maybe there is a relapse that could be starting up or that could be having active disease. We've talked about these things a lot. Some patients actually have high platelets. You don't just want to look for the platelet drop. The platelets rising could be a sign of a relapse. And then it may not sound that interesting, but you can always check out articles about Castleman disease. We have a lot that we've published in the last few years. There's been really an explosion of research papers and review articles that have come out just over the last 6 years with the most cutting edge research, and we'd be thrilled to share all of them with you guys. If you ever come across like an abstract online about a paper that you want to read that it's about Castleman disease, just send us an email. We'll get you the full text version of it, because sometimes you might have to pay. Don't pay for those articles. Just send us an email. We can get you a version of it. And then you can also find this information in our patient toolkit. After this meeting, we're going to make sure everyone gets sent our patient toolkit. You may have already received it before. We're just going to send it again. We're also going to send you the information that we give to physicians. And I can't remember, there's a third thing too that we decided we're going to send, but we're going to get you stuff. That's the baby brain that I've got going on right now. So then I think pretty much most likely all of you guys have joined the CDCN. That's just going to the website, cdcn.org/join, and on there you fill out a couple-minute survey. It's our way of knowing our community, who you guys are, where you are, so that we have you guys in this one database so we can help you the best we can. There's also a place where you can click to sign up for updates. And then the next thing is this, help us help you. So one of the first ways you can do that is to express your interest in contributing samples for research. So cdcn.org/samples. You can go online and you can say, I would be happy to give samples for research. As I said before, unfortunately we don't have unlimited resources, so we have to be really selective with the amount of samples we can get. It costs money to process them, it costs money to ship them, it costs money to do the research on them. It's about $500 to get a sample to do all the processing on, and then you have to do research on top of that, which can be thousands per sample. So obviously we are working on raising the money to do that kind of work. But in the meantime, if you can express your interest in giving a sample when we're able to, we'd love to get those samples. This is especially important if you're hospitalized. If you are in the hospital for Castleman disease, I know it's the last thing you're thinking about, but if you're the loved one of a patient that's in the hospital, please, please, please send us an email at the CDCN and say, my loved one's in the hospital. First off, we want to know so that we can send a card and we can start thinking about you and we can let people know that are in our network to think about you and pray for you. That's one piece. And the second piece is by letting us know, we can send out a kit with empty tubes. We can get in touch with your doctor and we can get samples drawn while you're in the hospital so we can then do research on those samples afterwards. Most Castleman's patients, when we're healthy and in remission like this, our blood looks totally normal. The things in our blood are normal. We kind of return to a normal person, our normal state. It's when we're sick that we can actually see what is Castleman disease. And I think something we should keep in mind is this idea that the cure is within all of us. And by that, what I mean is that Castleman's leaves these microscopic clues all throughout our bodies every time we get sick. I mean, it's there, it's wreaking havoc, but we're not going to be able to figure out those unknowns unless we get the samples. So we need the blood samples, we need the lymph node samples. So please let us know if you're experiencing a flare so that we can work with your loved one to get that sample while you're in the hospital. It's also important if you have a lymph node biopsy plan. A few of you guys have emailed us ahead of a planned lymph node biopsy and let us know, and we've been able to get a couple of those lymph nodes processed freshly after they were taken out and sent to our biobank. That's extremely helpful because if you don't let us know ahead of time, that sample will get processed in a way that makes it really hard to do research. Basically, they put the tissue inside of wax, and then you can't do the same kind of research that we want to do if we could freeze it first. So let us know if you're planning to have a lymph node taken out. Oh yeah.
No, I just want to ask you really quick.
Sure.
What if your test and you're here at Penn? Who should the patient or the loved one contact to say?
Whether you're at Penn or not, you should you need to let us know, because actually Dustin and the Penn team, she was hospitalized here at Penn twice with MCD. Yeah. Twice at Penn, and we didn't know about it in the last 6 months or something like that.
Oh yeah.
So, and we definitely don't want that to happen. Being here at Penn, we would have loved to have been able to support you and to be there for you. We would have visited you, we would have dropped you cookies, and we would have also taken some blood. But we would have, ask Gary. When he saw me walking in the room, I had a smile and I had empty tubes of blood. And I brought both of them every time. So yeah, you have to let us, if you're at Penn, you have to let us know. If you're not at Penn, you have to let us know also. We don't have to, but I hope you will.
So this number up here is a dedicated line just for our biobank. That's the line we generated. You feel free to call if you're going to get a hold of somebody at the end of 24/7. That cell phone is carried around somebody else's minds.
Just for samples. We have this phone. We have a cell phone for samples. That's how much we need samples. So please do call us.
Yeah, and then we have systems worked out so you will incur no cost. We send you all the materials you need to send the shipment back. There's prepaid postage. So all you need to do is pick those files, get them filled and properly set at the box. There's instructions with it, so we spend a lot of time trying to make this process very easy and streamlined because we realize it is one more thing for you to have to deal with when you're sick, and it's your health needs to come first. So we're trying to do the heavy lifting on our side.
Absolutely, yeah.
Do those files have a shelf life?
They do.
Yeah.
One for a folder, one
in both.
Yeah, they're vacuum sealed, so the vacuum just gets out in about 12 minutes.
So if you have tubes, you can only use them for about 12 months.
Yeah, I need to do that.
Yeah.
I was wondering if that was internationally, that we can send
It's a little bit harder internationally.
Yeah.
Yeah.
It's more expensive that way.
Yeah.
It's a little harder, but just stay in touch with us. We've gotten international samples shipped. If you're anywhere in the world, and if you're watching on Facebook Live anywhere, let us know if you're having a flare. We're going to work as best we can. We're going to cover all the costs. We're going to handle all the logistics we can. We'll do a telephone consent with you, so you just have to talk on the phone to Rosie, and we're going to get you consented. We try to make it as easy as possible. Help us help you.
Yeah, and to that point, we've gotten in samples from Australia and Brazil in the last 6 months.
Wow.
So we figured out ways to make this work.
And we work with your doctors too, so that like we're in touch with them. A lot of times they're really interested because they're totally confused by this whole Castleman's thing, and they love the idea that the samples could actually go towards figuring this thing out. So we'll be in touch with them and won't get surprised. Cool. Any other comments on questions on samples? So in parallel, the next most important thing, or equally as important thing, is to enroll into this natural history study. I used the analogy earlier of the puzzle, how each one of us is kind of one piece of this puzzle, and can't figure out a puzzle by just looking at one piece. When we put all of us in, we should hopefully start to see a story and start to see a picture emerge from within the puzzle pieces. As we said before, it's the first and the largest natural history study aimed at unlocking the mysteries of Castleman's. The main goal, if I had to say there's one thing for why we're spending years of our lives focused on this, is that we want to find the right drugs for the right patients. And something that Dustin mentioned earlier is we found that over 30 different drugs have been used to try to treat Castleman's disease patients in the first 100 or 150 patients so far. So doctors are trying lots of different things. I mean, we've only mentioned probably a handful of drugs today. Imagine another 25 drugs have been tried on patients that are on our register. So lots of things are tried, and some of them are working. Some of them aren't working. So we have to figure out what are those things that aren't working, and figure out what are those things that are working, and then we can try to create an algorithm to say these are the right drugs for the right patients. But we can't figure that out unless we get patients in there. Any questions or comments on that? And so, as we said before, it only takes about 20 to 30 minutes, and then we do all the rest. And by all the rest, what I mean is the average MCD patient has a little bit over 1,000 pages of medical records, and we have dedicated people who go line by line through every record, and it takes our data entry folks an average of about 100 pages per day. So for an average multi-center Castleman's patient, it's 10 days of full-time, 8 hours a day of scanning through every single page. And we do that on every patient. And so some patients have less than 1,000 pages. I have about 9,000 pages of medical records. So we go line by line through every single thing and put it into the database. It's an exorbitant amount of work. No one else is doing this for any disease. But we're doing it because we got to do it, and because there's answers in the data that are going to help us out. Cool. So really quickly, you guys, many of you are already in Accelerate. If you're not in Accelerate, CDCN.org/Accelerate. You provide your name, contact information. You complete just really basic information. There's an enrollment form where you basically sign things electronically, and then you fill out who are your doctors and what hospitals have you been at. That's really the main information we need. And once we know the doctors you've seen and the hospitals you've been at, we then contact them to get the records sent to us. And then we do all the heavy lifting to get them in. Any questions about Accelerate? Cool. All right, so then getting connected with other patients and loved ones. You've already done checkbox number 1. You guys are here. Hopefully you'll come back again next year. The next is to consider joining the Castleman Warriors program. Maleva's going to give a talk right after this about what is the Castleman Warriors program. We all consider ourselves Castleman Warriors when we have Castleman disease, but that term actually comes from an actual program that we started a few years ago called the Castleman Warriors program, where patients would actually have an opportunity to get involved in fighting back against Castleman's, to raise money, to raise awareness, to contribute to this fight. And so Maleva will go through what does that actually entail. The next thing is to connect with Maleva if you want to be connected with another patient or loved one that's going through something similar. I feel like we're just constantly going to talk to Maleva, and that's kind of our answer for a lot of things.
It's because I like to talk.
And you have lots of answers. So we really would love to connect you with her, and she can connect you to other people. Social media is obviously a great platform for this. Social media has been really active, particularly over the last year. Lots of posting, lots of comments, lots of really good questions. We actually use we go through some of the public information that's on Facebook and through social media for the questions that patients are asking and the challenges they're facing to help to guide some of our research. To say these are the kinds of things we need to start trying to answer with the research that we're doing. So this is the Facebook page. This is the International Castleman Disease Organization page, which is also really important for communication. And there's actually a couple others. Castleman Disease Support Group is another one, which is one. There are a few others that are pretty active. We'll talk about this a little bit more, but all of the research we talked about today, Dustin, in all of the studies he mentioned, they were as cheap as maybe a few $100s per sample to as expensive as like $17,000 to $20,000 per sample for some of the research we're doing. Something called single-cell RNA sequencing that Dustin mentioned is incredibly cutting edge. The technology didn't even exist 4 years ago. Like humans hadn't created it 4 years ago. We're using it on your samples, many of your samples. It's extraordinarily expensive, but these new technologies are opening up information that just never was even possible before. So we're really excited about the technology available, but they're really expensive. And so Mary made a comment earlier about how CDCN compares to others as far as efficiency of using every dollar, but also just as far as like amount of money that we spend. And you know, rare diseases of similar size to us have orders of magnitude of $50 million a year of a budget, as opposed to, I'm really proud of our $2.2 million over the last 6 years. That's incredible, because before that there was nothing. So 2.2 is, I guess that's exponentially more than zero, or infinitely more than zero. So you know, we've made really good progress, but the reality is that these diseases are tough to crack, and they're expensive. And so we're going to keep fighting and keep pushing, and helping with that is obviously really appreciated. Through the Warrior Program, we'll talk. You can set up your own fundraising page. You can reach out to friends and family and say, this is my story. This is the disease I'm battling. You know, will you support me? Again, email Lava. We also have a gala we put on in Philadelphia every year. It's coming up on November 16th. November 16th. 16th at 6:30 here in Philadelphia. It's at a really cool venue called the Prince Ballroom.
Email Lava.
It's always really fun. This is our fourth gala, and every year it's really fun. We have somewhere between 200 and 300 guests each year, and it's really a special